Welcome to CME on ReachMD. This episode is part of our Minute CE curriculum. Prior to beginning the activity, please be sure to review the faculty and commercial support disclosure statements, as well as the learning objectives.
Hi, this is CME on ReachMD, and I'm Dr. Emilie Vander. Here with me today is Dr. Karin Blakemore. Let's get right into our topic. Dr. Blakemore, what are the current diagnostic signs and symptoms associated with FNAIT?
Well, FNAIT is usually diagnosed by NATE. In other words, it's usually diagnosed in the neonate as the firstborn in that family to that couple, where a fetus may present with signs of thrombocytopenia. That would be signs of bruising or petechiae, and then sometimes other hemorrhages. And the worst scenario would be an intracranial hemorrhage that a baby may be born with or may develop very shortly after birth. There are almost always fairly low platelet counts in these fetuses, so the determination of a CBC with the fetal platelet count, or in this case, the neonatal platelet count, is going to be one of the primary clues that this might be NATE. And from there, you will send off for the platelet alloantigen typing between the father and the mother, or the fetus and the mother, to see what differences there may be. And the labs today will also do antibody testing. In other words, does the mother has she made antibodies to these specific platelet alloantigens that are to her foreign? She does not have these antigens and is forming an antibody to them. From there, the fetus or newborn will generally undergo imaging to look for any other signs of bleeding elsewhere in the body. A pulmonary hemorrhage, for instance, is also something that sometimes these newborns present with. And from there, the treatment is going to be with IVIG to the baby or a platelet transfusion.
Thank you, Dr. Blakemore. That was a great description. It is always tricky to know why a baby has low platelets after delivery, because there are many entities. Although FNAIT is the most common reason for severe thrombocytopenia in a newborn. And as you mentioned, with the risk of intracranial hemorrhage, it is really important to treat these babies right away to prevent kind of long-term sequelae. It is helpful, obviously, when we can make these diagnoses before delivery, but as we mentioned previously, it's actually pretty rare for us to see signs of fetal bleeding or signs of thrombocytopenia prior to delivery. So unfortunately, a lot of times these cases are discovered at birth.
And mild neonatal alloimmune thrombocytopenia, where there's only mild thrombocytopenia, is probably these days going to go completely missed because we don't do CBCs on every newborn. There may have been a time when we did, but it's long time since we are not going to be getting a CBC on every newborn where we're going to see mild thrombocytopenia. So most of the cases that we see are going to present with severe thrombocytopenia because we're then doing the CBC, because we see petechiae, or because we see some sort of a hemorrhage.
Yeah, you're right. Most newborns don't undergo any procedures, don't necessarily need any venipunctures unless they're having a circumcision or some other procedure that might alert people to sort of easier bleeding. So these milder cases can definitely be missed. Fortunately, they are typically transient platelet drops that increase over time. And so fortunately, we're picking up the babies who are probably most likely to be affected.
Yes, and with time, they do recover. They recover on their own. But it's interesting that while we say the incidence of FNAIT is 1 in 2,000 births, it may be higher than that.
Yeah, I think there's a lot still to learn about frequency of this disease in populations, because as I said, we aren't really screening for this. So we don't really understand truly what the general risk for this is yet. All right, well, this was brief, but we're glad we had the opportunity to share this information with you. Thanks for listening, everyone.
You have been listening to CME on ReachMD. This activity is provided by Omnia Education and is part of our Minute CE curriculum. To receive your free CME credit or to download this activity, go to reachmd.com/CME. Thank you for listening.